Human Sciences Research Council's 6th South African HIV Prevalence, Incidence and Behaviour Survey, specifically for KwaZulu-Natal province, has been released. Now, the survey sheds some light on the HIV/AIDS landscape in the region. Now, KwaZulu-Natal has the second highest HIV prevalence in South Africa, with approximately 1.98 million people living with HIV. Joining us now to delve deeper into the findings of the survey is Dr. Jooste, Chief Research Specialist in the Public Health Societies and Belonging Research Division of the Human Sciences Research Council. Thank you so much for your time on the show. So compared to other provinces, we know, of course, and we heard earlier on that Mpumalanga, in fact, had the highest HIV prevalence at 17.4% in 2022. So perhaps, Dr. Jooste, as far as KwaZulu-Natal is concerned, let's start with your overview just of the study's most significant findings in that province and what they mean for KwaZulu-Natal.
Good afternoon, and good afternoon to your viewers. Yes, you're correct. Free State had the highest proportion of HIV prevalence in the country, but you must remember that the population size of KwaZulu-Natal is much larger. So the highest number of people living with HIV is currently in KZN, as you mentioned, over close to 2 million people. What we saw in KZN is that the highest HIV prevalence in 2017 was at 40% in the 35 to 39-year-olds. That has now shifted to the older age group, the 45 to 49-year-old age group. And what we find is that there's a new peak now, HIV prevalence in the province, sitting at 44%. And that's an indication that people are living longer, but also an indication that there's still new infections happening in the particular age groups.
Notwithstanding, of course, that little bit of information in as far as the peak is concerned, what were some of the most surprising or rather concerning findings from that survey?
I think although the highest burden of HIV is currently in KZN, KZN also has the highest number of people that's on treatment, the number of people that's accessing ARTs, antiretrovirals, it's sitting at 87%. They also have the best indication of people that's taking the treatment and having a very low virus count, so they're not able to transmit HIV, and that's the viral load suppression, and that's also sitting at 87%. So those are the positive things happening in the province. What's a bit concerning is that the young group, the 15 to 24, we are seeing, although there was a decrease in HIV prevalence, it's still very high. And this particular group, the 15 to 24-year-olds, also they are less likely to be on treatment. That means that they are HIV positive, but they're unaware that they're HIV positive, so they're not being put on treatment. That was a big concern in this particular province, that the youth have worse outcomes than compared to the other age groups.
And I mean, it wasn't too long ago, earlier this year, in fact, that we heard that 1 in 4 people with HIV, not necessarily in KwaZulu-Natal, but across the country, are not on treatment. And I mean, how does that then, continue to inform the results that we are currently seeing in the country in as far as HIV prevention and treatment strategies?
It's very important that the message goes out. We had the dialogue today in the province, and I think one of the key messages was that there must be a concerted effort to get the information out, to get the campaigns going out, so that people can test. So that's one of the big issues that they're focusing on, to get people to know their status. Secondly, the prevention messages. Condom use has decreased in this province. So getting that message out of using a condom, increasing medical male circumcision, those prevention strategies need to be reinforced in the province. Because if somebody is positive and they're on treatment and they are virally suppressed, they cannot transmit HIV to their partners. And that's a key strategy that the country and this province is focusing on.
I mean, in terms of those findings, particularly as we're speaking about the youth, what are you reading into just these socio-economic factors that probably also play a role of some kind in HIV prevalence?
No, true. Look, for example, we find, as in most provinces, the burden of HIV is much higher among females. And when we look at the partners of the females, normally some of our youth 15 to 24-year-olds, they have older sexual partners. And when you look at the profile, the age profile of the province, males tend to increase their HIV prevalence as the age groups increase. So that is one of the risk factors that we see driving the epidemic, that you have young girls, having older sexual partners. Also, if those partners are not on ART and biosuppressed, the spread of the HIV will continue among that young age group. And lots of resources is focused on preventing, HIV in this young children, especially females.
In the main, I mean, would you then say that HIV prevalence in this country has decreased somewhat? And how much of that information speaks to the effectiveness of existing interventions and, and other actions that have been introduced over the years?
There's no doubt in all the provinces we visited now, people are working. There's lots of stakeholders involved in it. I think with the increase in ART coverage and treatment, we saw that a significant increase across the entire country. We're seeing more HIV positive respondents in our survey. It's actually virus suppressed. So we've seen that gains in treatment. Where I think where it's lacking is a coordination. We find many provinces indicating that although they have these strategies, some stakeholders working in the field of HIV are even unaware of what existing prevention campaigns are out there. So the need for more coordinated approach to fighting HIV, getting that message out, because I think we saw with COVID, during COVID, those messaging, everyone knew about COVID. It was disseminated at different platforms, and they feel that energy and that strategy should be, used in the fight against HIV.
All right, thank you so much for your time this afternoon, Dr. Shaun Jooste, from the Chief Research Specialist in the Public Health Sector, of course, just speaking to us there about those numbers in as far as HIV prevalence and incidence and behaviour survey is concerned in KZN, that is.